the Kaiser calculator. Now this is a really cool thing that I only found out about when we were preparing for this. So Elizabeth, what we want you to do is, first of all, let's talk about, maybe Tara knows this, who created this and why? Who created the Kaiser calculator?
So Kaiser, many people know the Kaiser Health System, but this is the Kaiser Family Foundation. And they do a lot of very good information on healthcare. They have reports on everything under the sun, and they do a ton of state-specific work. And this is a tool that they created a while ago and have been improving. And in fact, now it's improved to the point where, you know, CMS, they were getting so much flack about not having sort of estimates available on premiums and subsidies available without having to go through the entire sign-in process at healthcare.gov, that now CMS links to this and says, oh, hey, you might want to check this out. So it has that level of endorsement. So it's a very reliable tool, and the more information that you can give it about age and zip code and income, then it will spit out, you know, the math about what your premium tax credit could be.
So, and that's the beauty of this thing, is that you can, it's like playing a little video game with someone who's coming for tax time and let's run through it and see exactly what it will tell you. And I think Elizabeth has prepared an example for us. So Elizabeth, you want to chat about this?
Sure. So this is a very common scenario. You've got a single mother at the tax center with one child. She does not have insurance, and her employer does not offer insurance. Her child is on CHIP, but the mother needs insurance. So you can use this calculator to quickly show her how affordable insurance can be. Because I think sometimes talking about insurance in the abstract, it just sounds expensive, it's confusing. And this will give someone a concrete number like, oh, I could swing that. So here we've entered, you enter specific location, so the state, Texas, the zip code, you enter her estimated income for 2014, just a rough amount. Employer coverage available, no. Her employer doesn't offer insurance, that's what that's asking. Number of the people in the family, it's a single mom with one child. Then you enter her one adult, the age of the mother, 30, whether or not she uses tobacco. We're not going to enter information on the child because the child has CHIP. Then you hit submit. And then you can scroll down and see exactly what a plan would cost the mother. And, hello?
Yep, keep going.
Okay, great.
Yeah, keep going. We can hear you.
All right. So the key to focus on is the amount you pay for the premium. $400 per year, you divide that by 12, that's $33 a month. So the idea is that this will get the mother's attention. Oh, yeah, I can talk about that. That's something I could afford. Or if she questions that, you can scroll down a little bit further and see that a bronze plan under other levels of coverage would cost her $0 a month. So she could get a basic insurance at no cost to her, at no premium cost. So that may get her attention even more than the $33 a month. So that's the way you get to that. Well, and then you can do your referral. So to get more information, this is where you can go if that's your next step.
So Elizabeth, I want everyone to have a chance to talk about this, but when do you use this? At what point in the tax prep process do you bring this thing to the table?
Well, our idea is we're going to have some volunteers walking around the waiting area to sit down with folks, hey, do you have insurance? And to use their phone to show people this Kaiser calculator. The other people who can do it as an intake, oftentimes when the intake finishes going through everyone and you have to cut the list, your intake volunteer is just sitting there. So that's something your intake volunteer could do. It could be a way to engage your intake volunteer after you cut the list, and but they've got people who are going to be waiting for a couple of hours. They could also look at the Kaiser calculator with people. Hey, let me show you something. We've got there's an opportunity with new benefits with health insurance. I can show you what it could potentially cost.
Okay. So I've got a note from Tiki. Tiki, I so wish we could hear you. We might want to try again, but she wrote me that she thinks it's also important to raise the fact that a consumer has an option to apply some, all, all, some, or none of the tax credit. And she said, by the way, I love the Kaiser tool and use it in almost every application session I have. So do you want to talk about this, Tara, about how a consumer, or Elizabeth, can apply all, some, or none of the tax credit? What does that mean? Apply all, some, or none of it to what?
So when you go through the actual application process, you enter in your income, and you'll find out what tax credit you are eligible for. But of course, we're entering in an estimation of income for 2014. So we're really doing an educated guess. And you might feel insecure about the guess that you've made, or you might just be someone who likes to play it safe. And so rather than taking everything that you think that you would be eligible for, some people like to scale it down and say, okay, I'm going to hedge my bets just a little bit. I'm not going to turn it down entirely, but what I'm going to do is I'm going to only rely on and only use up front, 75% of my credit. And then if all my projections ended up being correct, I know that I'll get that money back later at tax time when I file my return. So I'm not losing the money. I'm just saying that, I don't want to be on the hook and have all this money delivered up front and then find out I get a smaller credit. So it's really a tool to kind of hedge your bets about your own estimation of income.
Okay.
Hello?
Yeah.
Hi, it's Tiki. I'm sorry. I finally got things working.
Tiki, we're so delighted. So do you have anything else to add on how you've been using
perfect, actually.
Okay. Nothing else to add about it. So when do you use it? You said you use it in every application session. When do you have people use it?
Typically, I get phone calls initially wanting to find out information about the whole act in general, and more so about the premium tax credits, because I think there's a misconception that everyone that applies for the insurance is going to be eligible for the tax credits, and that's not the case, because it is based upon taxable income, the amount of taxable income for the household. So that's the first part of education that I have to provide, and then I will have a consumer who, I will go through the Kaiser tool and basically give them if they're potentially eligible for those tax credits, and from there they will decide whether they want to proceed or how they want to proceed in applying for the application. Because we were formerly a subrecipient of the or subgrantee of the VITA grant, we still have our relationship with all of our tax sites, and so like you were saying before, there will be an opportunity for me to come in either when a taxpayer is sitting in the lobby waiting for their appointment, or as they're waiting to find out what their refund is, to have a conversation about the ACA. You only have a small window of opportunity, typically before the taxpayer finds out what the amount of their refund is going to be, because at that point you've lost it, and all they kind of hear is that number. So there's a small window of opportunity for me to go in and talk about these things.
So let's hear from, thanks Tiki, let's hear from Gail. Do you have anything you can offer about anything you're doing to provide information, or any questions about providing information on the ACA at tax sites? If you can unmute yourself, Gail, and let us know. Gail? It says she's there. Let's try Phyllis. Phyllis, anything you can offer, or anything you want to mention about what Phyllis? I see you're live. Go ahead.
Well, I appreciated the comments about the time, because I'm part of a VITA coalition that is through United Way that we're trying to reach several different counties, and one of the points that they made is that the volunteers don't want to take a lot of time. That when they come in, they want to do the appointments. The consumers only want to just take time to do the appointments. They're really not interested in education. So I appreciated the comments about how we can make a few points in a short period of time. I'm also interested in any kind of written materials that we could have available. So will the piece from Texas be posted so that we would have access to seeing what others have done, some of the sample pieces? I'd appreciate any kind of written materials that we might be able to provide. At this point, the thought is that we will just have an information piece there to refer them to a CAC or a navigator. But I'm hoping that we can do a little bit more than that, but at this point, that's what the plan is.
Yeah, on the written material, we'll definitely have the written material on our website. So I know that Elizabeth will share it with us. So if we could put it up there, you could probably easily adapt it.
Great, thank
Absolutely.
you.
I can post that after this is Travis. I'll post that following the call, and I'm also willing to post handouts from any sites that are on the call that want to share the materials that they're using at their VITA site so that everybody can see what are the different resources being used around the country.
And Casey or April, is there anything you want to ask about here or anything you're doing that you think could be helpful to others? At this point, you have to unmute yourself. April, you're unmuted. Go ahead. April?
I'm not sure there's anything that we could add as far as what we've been doing. And Casey is in Warren County, and I'm in St. Charles, and we've just been doing weekly meetings as CACs just to figure out what we're doing for enrollments and who we can reach out to, and that's helped us a whole lot as far as where we can go to do outreach, and that helps us a lot.
Okay. Anything anyone else want to add before we move to the next section on application? Okay.
Will you also be
this is
posting
Gail.
the
I don't have,
Go ahead, Gail.
okay. I was going to say I do not have anything to really add to this. It's just that we have found here, like many of you have, that our tax counselors, they come to volunteer to just prepare tax returns. They're not interested in doing anything else. So we have begun trying to recruit volunteers to work, the group of people that they're waiting, so that we have volunteers that will actually walk around and try to engage people with the ACA, and then we're hoping that that'll help. But yeah, the thing of it is that you have your tax preparers, and they're really good at what they do, and they're really not interested, and I don't want to push them because I like having them come back every year.
Yeah, I mean, that's a really interesting point. I had never thought about this because some of the volunteers really actually are tax preparers in real life who volunteer on the side, and they don't necessarily want to get into this. They just want to do what their expertise is. I liked the earlier comment that if you make an argument to the tax preparers that this is another way to increase these people's bottom lines, then they might want to do it, but they still might,
And this is Tara, and I just wanted to add, echo what Elizabeth said earlier, which is that they're going to have to deal with this next year. And they are volunteers because they'll have to be in a position where people will be reporting the mandate to them. And if your tax site is like mine, you have a lot of return customers. And so the lady who's been coming to me, for the last 6 years and knows me by name and calls me her tax girl, then I want to make sure she is prepared, because she's going to come back to me and she's going to blame me if she's not prepared, right? And not everyone is going to be quite like that, obviously, but I think that might be one hook for volunteers, especially, you're building relationships, you're getting people's trust. And I think that people will want to know certain information so they can be prepared.
That's a really good point, Tara, and I think you'd made that point before, but it's underlined now that actually they're going to need to know this stuff next year, so they may as well learn it now and strengthen that relationship with the customers too at the same time.
Yeah, I like your that be prepared. I think we might make buttons out of that.
Ooh, that's good.
Some kind of way, this year's tax clinics, because I do have a couple more weeks because we can't do anything till February 1st almost. Maybe be prepared ought to be some kind of a tagline for this year.
As long as it doesn't sound like the apocalypse. It's not the apocalypse.
No, yeah, right.
Yeah, you don't want the sublet thing to be the end is near. You don't want that.
Yeah, right. Yeah, thank God it's not 2001, right?
Right. The Mayan calendar is not, intervening with our tax prep and our healthcare sign-up. Yeah, that's good.